of clinical workers and researchers have made great effort to understand the pathogenesis and clinical characteristics and develop effective drugs for treatment. However, no effective drugs with antiviral effect on severe acute respiratory syndrome, coronavirus, have been discovered currently. Iranian traditional medicine or Persian medicine has a 1,000-year history of experience with all types of infectious disease and has been employed previously and as effective treatments for severe acute respiratory syndrome. We report that ITM is currently in wide use for treatment of uh, COVID-19. In this research, we summarize the clinical outcome, pathogenesis, and current application of ITM, Iranian traditional medicine or Persian medicine, for the treatment of COVID-19. Number of infected cases in Iran, according to World Health Organization, in 28th May, 141,000 confirmed cases and 7,000 deaths. Currently, there are no available vaccines or specific medicines for the treatment of COVID-19. In light of the outbreak, various treatment modalities have been considered, including traditional medicine, which has been widely used during the past epidemic outbreaks, such as severe acute respiratory syndrome, SARS, and H1N1 influenza. The value of plants used in traditional medicine for drug discovery is obvious and important. From that point, the development of traditional medical systems incorporating plants as a means of therapy can be traced back only as far as recorded documents of their likeness. However, the value of these systems is much more than a significant anthropologic or archaeologic fact. Their value is as methodology of medicinal agent, which according to the World Health Organization, almost 65% of world's population have incorporated into their primary modality of health care. In according we choose medicinal plants based on Iranian traditional medicine. That's why are adapted the symptoms of COVID disease to Persian medicine or Iranian traditional medicine. Using 39 keywords extracted about Lyme disease, we explored Lyme disease, we explored the next explore the text of the book Makhzan al-Adwiya. This book is one of the most important and complete pharmaceutical books or mufradat in Persian medicine. 464 medicinal plants or natural source related to these keywords were found. Of these, 318 plants had scientific names, and in the next step, we screened the plants based on these effects: anti-inflammatory, antiviral, and immune system regulation, and related to AC inhibitor 2 receptor. Final 50 of these plants were used more common in Iranian or Iranian traditional medicine or Persian medicine. Therefore, this number was examined in terms of modern studies and evidence of conventional medicine. Finally, by examining 540 studies related to plant keywords and pulmonary symptoms, 8 plants were selected. And design clinical trial with inclusion criteria: patient with one or more of the following symptoms in addition to acute respiratory disease, acute respiratory infection, respiratory rate 13, O2 saturation less than 90-30%, pulmonary infiltration in chest X-ray, clinical judgment of a specialist. Age range of 18 to 75 years in both genders, lack of any serious concomitant disease of the heart, brain, or lung, metabolic disorder, and etc. The patient's ability and own will to fill out a personal consent form for inclusion in the study patient not intubated. And exclusion criteria: pregnancy and lactation, need for intubation, gastrointestinal intolerance, resistant hypoxemia, reduced level of consciousness, hemodynamic instability, hypercapnia, respiratory fatigue, and any manifestation of non-side effect of any of the herbal product component. Specific astrazeneca. Intervention group: 150 patients receive herbal treatment, including 550 milliliter of decoction: Matricaria chamomilla, Zataria multiflora, Glycyrrhiza glabra, Ziziphus jojoba, Ficus carica, Ortica dioica, Alto officinalis, Hisopus officinalis, 3 times a day, and capsules include lyophilized powder from hydroalcoholic 70% extracts of Ponia grantum, Rom palmatum, and seed powder of Nigella sativa, 2 times a day with routine interventional based on the instruction of the Ministry of Health of Iran for 1 week. The and control group, 150 patients receive routine interventions according to the instruction of the Ministry of Health for 1 week, and the current medical treatment program made our research difficult. Confusion in treatment caused until the treatment of patient is constantly changing hydroxychloroquine and azithromycin, 1 day plus naproxen, atazanavir, or remdesivir, which was not effective except remdesivir. Another day, another drug. Another day, another dollar. Nigella sativa is important in combined in polyherbal decoction, and capsule is immune system regulator, ACE inhibitor blocker, antiviral effect in coronavirus, SARS and MERS virus, and in anti-inflammatory effect. In Persian medicine, black seed is excellent and has many applications in various respiratory diseases such as chest pain, dyspnea, cough, whooping cough, fever, shortness of breath, chronic postnasal drip. Zatari multiflora or Avishan Shirazi from the patient of Persian medicine, possibly moisture and eating it with fig juice for usury and cough. Anti-inflammatory, antibacterial, antiviral, immunomodulatory effects of thyme extract improves FEV1. In a clinical study, 2 months of treatment with thyme extract reduce inflammation, increase anti-inflammatory cytokines, and improve pulmonary function test in patient. Glycerin glabra is, from the point of view of Persian medicine, is very important. It is used for asthma, wheezing, heartburn, shortness of breath, and lung disease. We nominate in منزج اخلاط غلیظه مصلح اخلاط رقیقه, alike similar dampness and stagnation of phlegm or the other akhlat. The therapeutic effects is lung disease and in anti-inflammatory, antimicrobial, antioxidant, and immune boosting properties have been proven for this plant. Licorice has a strong antiviral activity that prevent the virus, specific SARS and MERS, and hepatitis C virus has been proven. Matricaria chamomilla is bride of herbal medicine and very effective in diseases such as chest pain, dyspnea, and postnasal drip. We nominate نزله مرکبه. Ponica granatum, it is stated that drinking pomegranate juice is very useful for chest pain, cough, chronic cough, and clearing of the voice. Among the herbs used in traditional Chinese medicine, the effect of pomegranate fruit have been shown to be potent antiviral against herpes simplex virus type 1, respiratory syncytial virus, RSV. The immunomodulatory effect of pomegranate have been proven. Pomegranate has a strong anti-inflammatory effect. And Revand in Persian medicine, Rom palmatum in the source of Persian medicine, many applications such as asthma, cough, chronic cough, fever, shortness of breath, and nasal congestion in upper respiratory disease. Ziziphus jojoba, it's important to in ameliorate of stagnation and dampness, dryness of the chest, and chest and lung disease. And immunomodulatory effect of jojoba is important, and effect to thrombus and emboli with aggregation of platelets. Anti-asthmatic activity of jojoba fruits is models induced in mice. And final symptoms began to improve 1.3 days earlier than the control group. In patient days range from 4.9 days to 2.6 days, and very statistically significant. Cough in the intervention group is significant. Other symptoms were not significant. Thank you for attention.
Thank you, Dr. Karimi, for your nice presentation. Dr. Humane Kazemi, please start your presentation.
Hello, everybody. I hope you enjoyed the conference until now. This is a great opportunity for everybody to share the clinical experiences of the integrative medicine, complementary medicine, herbal medicine, traditional medicine, different type of actually integration of complementary medicine and current medicine for the COVID-19 that's a big disaster now around the world. I continue the conference with my speech. My speech is about herbal medicine, especially Chinese herbal medicine and Chinese medicine approach for COVID-19. So if you can see my slide, then I talk about that. Okay, so Chinese medicine approach for the COVID-19, actually there are different syndrome differentiation. It's called kind of Wenbing in the ancient times, this kind of viral disease. Sorry, there is some technical problem, so I'm waiting for that. چه اسلاید دیده نمیشه؟ So I don't know if you can see the slides or no. Okay, so.
Yes, sir.
As I said, according to Chinese medicine, this kind of viral disease like COVID-19 is a kind of Wenbing. And are you here? We can see actually, according to Chinese medicine, is a kind of external pathogen. Is start with the cold damp, then it's changed to the damp heat, and actually the most common type of the syndrome differentiation is damp heat. And as you see here, you can see it's attack the body as an external pathogen, like a wind cold. Then there is more and more damp. Then it's changed to the cold damp. It is the early phase of the disease. Then it's changed to the damp heat. Then it's changed to the patient has more yin deficiency, and finally the patient has lung and spleen qi and a lung yin deficiency and lung damp and heat. That's actually pneumonia. So not everybody goes to pneumonia. So it's a different stage of the disease. I have to be a little faster. So we can say in the early phase is a wind cold invading the exterior, or maybe toxic heat attacking the lung, or damp cold in the lung. Then in the pneumonia phases, who get the pneumonia phases, the patient has a damp heat in the lung, or the patient with the toxic stagnation, obstruction in the lung, and I hope the patient get recover and then go to the recovery phases. In the recovery phases, normally is a kidney, yin and yang deficiency, or spleen qi deficiency. If you are familiar with the Chinese medicine, the definition and Chinese medicine syndrome differentiation, you can understand the points. If not, is a good chance for you to become a little familiar with the Chinese medicine here. So let's talk about the different phases and talk about the Chinese medicine treatment, Chinese medicine herbs. I try to tell you some herbs according to Chinese medicine. In the early phase, if it's a wind cold invading the exterior, the sinus symptom normally is aversion to cold, chill, headache, itchy throat, maybe muscle soreness, maybe low grade fever or maybe no fever, pale tongue, floating pulse. And actually in this phase, the patient doesn't have that much symptom. I mean, the patient are okay. So many patients are in this phase, okay? So the treatment here, we need to expel the wind, release the exterior and clear the heat. Very good decoction here is a Gegan tongue, is a good decoction. So in the Gegan tongue, we have Gegan for 15 milligram, Ma Huang, Guizhi. Ma Huang is ephedra, Guizhi is a cinnamon, Baisha is a radix, Shenjiang is a ginger, Gansao is a Licorium, and Daza is a jujube. So you are familiar with this kind of herb. And sometimes we can add Jin Yinhua is a kind of flower, is a kind of crystalline flower to clear the heat. So this can be the good herbs, good formula for the wind cold invading the exterior. Another syndrome differentiation that is more common actually and is a more severe, the patient has fever or high fever in this state, is a toxic heat attacking the lungs. So the patient has cough with the maybe yellow thick phlegm, fatigue, headache, pain, and all the symptoms are more severe here, dry or bitter taste in the mouth, constipation, irritability. As I said, this normally the patient in this phase goes to the doctor, and normally we see this phase. The last phase maybe is actually not that. I mean, the patient don't care about that because it's not very severe. So here we need to expel the wind, release the exterior, clear the heat. Very good herbs here is yin chao san and or modified Qing Wen Baidu San. This is the name of the decoction. So what's the ingredient of this decoction is Jin Yin Hua, Lian Chao, Jingjie, Niu Banzi, Bohe. Bohe is a peppermint. Gancao is a licorice. Danzhuye, Lugan, and Huangliang. So some of these herbs, they are Chinese herbs. Some of these herbs you can find it in everywhere. And actually, I also I wrote the name in the scientific name so you can search. So I want to show you the picture of the tongue for this syndrome differentiation. Actually, you can see the heat. So the redness in the center of the tongue, it means heat. Toxic heat. Actually, this toxic heat from exterior goes to the interior already. So it was a patient. He started with a fever, cough, and then the situation become worse, goes to the pneumonia, and we did a treatment for him with the herbs, combination of Persian medicine herb and Chinese herbs. Another the syndrome differentiation is a damp cold in the lung. So in the damp cold in the lung, normally the patient has aversion to the cold. Maybe fever or maybe no fever, dry cough, dry throat, fatigue. Sometimes they have a chest stuffiness, maybe epigastric distension, nausea, maybe diarrhea, because in this phase also the patient has lynchy deficiency as well. So maybe nausea, maybe no appetite. What we should do for the treatment, we should expel the wind, release the exterior, and dispel the damp cold. So very good herbs here is a decoction is a combination of Tangzhu Chenpi. Chenpi is a citron bark. Hopo is a magnolia bark. Huoxiang, Gao Caogu, Mahuang ephedra, Qinghuo, Binglang, and Shengjiang ginger. So also it's a very good decoction for the damp. With a little coating and the split coating. Okay, so let's talk about the pneumonia phase. Actually, many patients Iran and Gansao. So it's a very good combination for the damp heat in the lung or pneumonia phase. Here, Dr. Karimi is beside me. He did a lot of good treatment with the combination of the herbs for the patient with pneumonia. Another, actually, this last phase, and it is the very severe one, is a toxic stagnation, obstruction of the lung. So in the toxic stagnation, obstruction of the lung, what we see. Sign and symptom here is a fever, head sensation in the body. The patient has a wheezing, dry cough, or sometimes actually cough with sputum, chest operation, dry mouth, bitter taste in the mouth. Actually, here the situation is a worse. I mean, here there's a worse condition of the patient. Maybe the patient has the decreasing of the O2 saturation. So here the treatment is we should transform the stasis. According to Chinese medicine, blood stasis, qi stagnation makes the condition worse. The collateral, if they have a stagnation, the patient has actually this kind of condition. So we need to open the orifice, open the collateral, transform the stasis. The good treatment here is a Bai Hu Jiao Ren Shen Tang. So Bai Hu Jiao Ren Shen Tang is a combination of Shigao, Renshen. I'm sure. Sorry, I'm sure you know Renshen. Yeah, the Renshen is a ginseng, Gengmi, Zhigan, and Zhimu. So the herbs here we use is actually some of them they are a little maybe toxic, so we should be clear because this is toxic stagnation. We can use ginseng or renshen. Ginseng or renshen can tonify the qi, tonify the kidney, tonify the yin, especially if you use the fragrant ginseng. So I advise you use. Strongly recommend that you use the fragrant ginseng because it's a good to tonify the yin, so we can use it for many patients. And you can see the tongue here actually is good picture. It was the patient that we did the treatment for her, with the combination of traditional medicine and classic medicine. You can see the blood stasis. If you see the center, the center is the little black or little darker actually, or purple. It means severe stagnation, severe blood stasis, and also there is a redness around. Actually, after the treatment, it's become better. So it's a kind of toxic heat, toxic obstruction, yin deficiency. You can see the crack in the center, and you can see some thick coating. That means severe phlegm actually for this patient. So that was a very good treatment for this patient, for example. Okay, so finally, thank you very much. We are going to talk about the recovery phase. So almost everybody goes to recovery phase. In recovery phase, the patient has a lung and spleen qi deficiency. So why? The patient has a fatigue for a long time. Personally, myself, I infected by coronavirus 3 months ago, and still I have the severe fatigue, severe problems. So I can understand really recovery phase is very important because the patient has a lung and spleen qi deficiency. So the patient maybe has a poor appetite, still maybe the patient has dry mouth, easily get the fatigue, easily get the maybe digestive problem. So here we need to tonify. And actually I can tell you, for all of us, this is the phase that we can do the treatment for the patient with the tonify the qi, nourish the yin, and tonify the lung. Very good treatment here in the recovery phase actually is Sha Shen Mai Dong Tang. So Sha Shen Mai Dong Tang is a combination of some herbs like Sha Shen, Mai Men, Yu Zhu, Shang Ye, Tian Hua, Bian, Bai Bian, and Gan Cao. Okay, because we talk about Gan Cao a lot of times, Gan Cao is a licorice. It's called Shirin Bayan in Farsi. Is recommended for all the patients we use it, but just be careful. It has a side effect, and we cannot prescribe it for a long time. Anyway, I want to emphasize again in the recovery phase that maybe we don't know how long is the recovery phase. As I told you, I infected by coronavirus 3 months ago. Still, I'm in the recovery phase. Also, we recommended you do moxibustion and acupuncture. So for acupuncture, we tonify yin, we tonify spleen, we tonify qi, we tonify lung. We can use lung 9, lung 7, stomach 40, stomach 36, kidney 3, kidney 6, kidney 7, ren 4, ren 6, and also the back point for the bladder, for the gallbladder, for the kidney, for spleen, for the lung, and for the heart. That if you are acupuncturist, you know. So also moxibustion is very recommended. So in the recovery phase, we can do a lot for our patient. Okay, thank you very much. I just show you the last prevention. Because everybody looking for prevention except mask, what you can do, yeah, except the, use the physical distance, wear the mask, and that's everything you do. We should tonify the lung qi, we should tonify spleen qi, and we should evade of any pathogenic qi. So here we can use Yu Ping Feng San. Yu Ping Feng San is a very good decoction to tonify the qi, tonify lung qi, reduce the phlegm, remove the dampness, relieve the pain, and tonify the spleen qi. The Huan qi, maybe you know Huan qi astragalus. This is very, very good herbs to tonify the qi, beside Renshen or ginseng, Baiju, and Fang Feng. So you can prescribe this for the prevention for your patient. This is the simple decoction. The rest of my slides is about the Qingfei Paidu Tang. You already know about this. You heard a lot. This is one of the famous or most common Chinese decoction for the COVID-19, and before they use it for the SARS as well. So there are different, actually, different type of the Qingfei Paidu Tang, like Wuling San, Shegan Ma Hua Tang, Xiao Chui Hui Tang, and Ma Huan Xing Ren Gan Cao Xi Gao Tang. So they are the name of the herbs. No worry. Okay. So this is just the prescription of the Qingfei Paidu Tang, as I said, the most common or most famous Chinese patent or Chinese decoction or Chinese formula for the pneumonia with the COVID-19, Ma Huan or ephedra, Ji Gan Cao, Pu Xing Ren, Xi Gao, Gui Zhi, Zi Xie, Zhu Ling, Bai Zhu, Fu Ling, Chai Hu, Huan Qing, Jing Ban Xia, Shenjiang, Jiwan, Guangdong, Shegan, Xishen, Shanyao, Jixi, Chenpi, and Guanghua Xing. If you are interested, you can take a picture of this and then you can search the scientific name. And there are just some articles that with the traditional Chinese medicine, the treatment, the patient for the coronavirus, and before they had experience for the SARS, for example. For the SARS, also they use the herbs like dahuang, yuxing cao, liji, banle, gen, and others. And this is also not bad. This is the last my last PowerPoint. This is some of the herbs that have the antiviral activity, like gansa or licorice or shirinbayan. This is very actually has a effective function for the certain viral infection. Shen Ma also is effective for the viral disease and is for virus. And Cho Ling Dan, also in the research we found some antiviral activity for these herbs. Okay, so my aim actually was, this is the very short time to explain about all these herbs or all this syndrome differentiation. I just want you to become a little familiar that with the Chinese medicine, also with the Persian medicine, with the herbal medicine, we can help a lot for the patient, especially now. You heard chloroquine or other medicine, they have a lot of side effect, and there is no any clinical experiences or clinical trial approved the chloroquine, that everybody in the world they use chloroquine. Okay, that's okay. This is not our job, it's not our business. But I just want to say, if the herbs prescribed by specialists, herbs has antiviral activity, and herbs combination of herbal medicine based on the Persian medicine or based on the Chinese medicine can help the patient. And why not we use the integrative medicine for COVID-19, and I'm sure in the future more and more doctor and patient they use integrative medicine for all their diseases. Thank you very much. I hope it was useful for you.
Thank you, Dr. Amir Human Kazemi, my dear friend, and thank you for your very nice presentation. Next presenter, Dr. Ajar Jabin from Jamia Hamdard, India. Please start your presentation and please share your PowerPoint and slides to start your speech. Thank you.
Thank you. Assalamu alaikum to all of you, and hi and greetings to all the viewers here. I am from Jamia Hamdard University, New Delhi, India, and I am very much honored to present my presentation here. And I should thank the organizers for providing me this opportunity to speak on scope of Unani medicine in this COVID-19. And I'm here to share my presentation here. And since oh, there's some problem. And so hope am I audible to all of you? Can I give an okay? And this way, I want to actually, I have been given only 10 minutes to present my talk. I am Dr. Azhar Jabi, and I am actually Unani physician. And my presentation will be on scope of Unani system of medicine in COVID-19. And this is my university. I should now come to Unani system of medicine, and there have been earlier presentations on this system actually by the different name, by Iranian or Persian medicine. Unani system of medicine, it is also called as Greco-Arab and Persian medicine because of it is like the development was in Arab and Persia. In India, this system thrived and is integrated into national healthcare system and officially named as Unani medicine. Now, the modes of Unani treatment. Let me first of all discuss the modes. There are three modes usually in Unani system. One is non-pharmacological mode, what we call as ilaj with tadbir and dietotherapy. And then there is pharmacotherapy and then surgery. The basic principles of managing infection or managing any disease in Unani system of medicine. Is my presentation visual? Is it?
Yes, ma'am.
Okay, thank you.
Thank you.
The basic principles in Unani system of medicine is like to destroy the causative organism, which we called as sabab ka izala, and then to improve body self-defense mechanism to combat that disease. And for this, we potentiate and stimulate the power of self-preservance, the tabiyat, which I will be explaining in next slide. And our this approach when we treat this disease, our approach is holistic as well as individualistic. Holistic means taking consideration of whole the body with the surroundings and the environment in which the patient is living. And also individualistic approach is like we have to take into consideration of mizaj and akhlaq, that is temperament of the body, organ system, disease, as well as the drug that we have to give to the patient. And the focus is on potentiating and stimulating the power, this tabiyat power, self-preservation, so that body can itself fight against the invaders or prevent it from these toxic invasions. The concept of immunity in Unani medicine, there is it's very vast, and focus is always remains on the basic, actually the immunity or quwwati mudafa and quwwati mudabbira of the batan. These are the defense systems within the body to protect the host from the invading pathogens. And quwwati mudabbira is the power of self preservation, or adjustment which strives to restore normal physiological functions within state of individual, and its ability to neutralize and eliminate the pathogen microorganisms and their toxic products, thus providing protection to the individual. In Unani system of treatment, great reliance is placed on this power, the aim of physician being to help and develop rather than supersede or impede the action of this power. The health state is believed to be based on sophisticated fine maintenance and control of immunoregulatory mechanism, and this is governed by the power of self-preservation. And one of the therapeutic strategies in Unani medicine is also to increase body's natural resistance and helping Quwwat Mudabbira to restore the normal health rather than directly neutralizing the agent itself. This is achieved by using various drugs mentioned as tonics or mukawiyat in Unani classical literature. And the main clinical objective of immunostimulants is prophylaxis against the opportunistic infections. Now, immunostimulant drugs are those which enhance the body's immunity and enable the body's resistance power more efficient in order to prevent the body from various kinds of infections, immunodeficiency diseases. Now, as far as concept of infectious disease and epidemics is concerned in Unani system, it has been already, I think, earlier presentations have given about, have elaborated this. In Unani system, it's known as Waba, and it is thought to occur through Ajsame Khabisa. It is evident that despite the inability to observe microbes, Unani scholars could envision and comprehend their sources and reservoirs, modes of transmission of infection, and potential causes of infection turning into epidemics. Their theories and observations closely resemble the contemporary knowledge of infection, which reinforce the fact that Unani medicine can play a significant role in combating current health problems. And you can see they were well aware about the transmission, about the tadia, huma, and about the incubation period, quarantine, and also I won't go into detail since time is short. And let me come to this prevention. As far as prevention of any disease, viral disease or infectious disease is concerned, or any epidemic is concerned, we know that Avicenna was the first to use 40 days isolation, and this was known as quarantine, and it was adapted by Vietnamian merchants and European ones through their world wars and during epidemics. The preventive measures for epidemic disease are collectively aimed towards the importance of immunity, prevention of spread of infection, hygiene and antiseptic measures, and promotion of general health. Host defenses are given particular importance, and according to Razi, people who come physically active and exercise regularly have a less susceptibility to epidemic diseases. Patients having a weak constitution and those suffering from underlying disease are said to be more susceptible during epidemics. The basic measures advised is to avoid places where an epidemic is spread. In case it's not avoidable, then a person advised to stay at well-ventilated place, preferably distant from the ground. When interacting with the patient, care should be taken that the air currents may not be directed from a patient to the healthy person. And during epidemics, it's also advised to avoid unnecessary physical exertion. Now, immense stress is placed on purification and sanitization of surroundings during epidemics. And Unani physicians employed medical herbs and as decoctions and distillates to spray or as fumigants to keep the air free of contaminants. And homes should be sprayed with diluted vinegar to keep the air clean. And according to Zakaria Razi, some aromatic drugs can destroy infectious agents and should be used as fumigants during epidemics like ambar, loban, sandrus, and other that I have mentioned here. Since these contain volatile oils with biologically active substances such as alcohol, terpenes, which may provide air purifying effects on fumigation, but much of potential is yet to be proved through clinical trials. And you can see on screen all these the herbs that I have written here, they are used as fumigants. And more emphasis is given on dietary modifications. Unani physicians were aware of the immunomodulatory effect of citrus fruits. Besides, other measures of health promotion during epidemics include having a wholesome diet, avoiding starvation, avoiding meat and fish, and staying hydrated. And it was recommended that scungibine may be advised to patients for during the epidemics and for the prevention as well as during as in treatment. This is a mixture of honey, water, and vinegar that is boiled in a syrup form, and then archeglob is added to it, and it is being advised to be taken during this epidemics. Now, health, as far as health protecting drugs measures, they need a special mention here. And certain drugs have also been prescribed for the purpose of health promotion, like Revancini, Gulibnafsha, Halela, amaltas, turanjibine, abi anar, vinegar. Vinegar may also be taken orally as part of diet or salad, etc. And Ibn Rushd has given a description of medicine, which he made a curious claim, like whosoever has used this formulation during one epidemic remained protected from it. It was sibr, which is aloe vera, murmuki, commiphora muki, myrrh, and each one part, and saffron, 2 parts. This formulation was actually has been advised, and it has been recommended by different renowned Unani physicians. Now here I am actually presenting some of the what we call as immunostimulants. These are some drugs, single drugs, which have been found through studies that they have an anti-inflammatory property, they are antioxidants, and they are again immunostimulants as well. So Unani therapy has a very powerful role to play in the prevention of different viral diseases by immunostimulant property, or they have antiviral property. These may also enhance the bioavailability of modern chemotherapy to maintain their sensitivity and overcome the resistance. And for this reason, such immunomodulators or such immunostimulants are being given. They are given for the prevention as well as for the treatment of the infections, and they can be prescribed in this COVID-19 infection as an add-on therapy. And the Unani pharmacopoeia drugs that are known, I have presented here, that are known to possess immunomodulatory properties, and generally
please 2 minutes. Please 2 minutes.
Okay, fine. Thank you. And these are actually the immunostimulants. Let me come to this. These are some Unani compounds that we prescribe, like Khamira abrasium, Khamira gauzaban, Khamira. They are all, and studies have been done that they augment the self-resistance, strengthening the vital organs of the body. They can be prescribed in this COVID-19 as an adjuvant, as for preventive as well as for therapeutic use. And then let me come to possible approach to prevention and management of COVID-19. And for these, let me say, we have to deal with for preventive as well as for therapeutic use. The drugs can be given in decoction form, that is behdana, unnab, sapistan, and khaksi, because this COVID, the symptoms of the COVID resemble very much to one epidemic waba that we called as nazla wabai. And since the symptoms resemble upper respiratory tract infection, upper respiratory symptoms are more prominent in this case. And this is the drug of choice in Unani system of medicine, Bihidana, Unnab, Sapista, and Khaksi. That in this dosage form, they are given in decoction form. And then if there is diarrhea, Habbal As and Tabashir can be given. And for relieving thirst, Shire Tukhme Kahu, that is Lactusa stiva, it can be given. And for the application, local application on chest, Karuti Arad Karasna, with aloe vera and Croctus sativus, that is saffron. They can be crushed, mixed, and warmed slightly. Then they can be applied on the chest and covered with the cotton bandage. Now this is my last slide where I will brief the entire recommendations from Unani system of medicine in COVID-19. we have here, you can see the list of drugs, immune enhancers. They are all immunomodulators. They have antiviral, anti-inflammatory, antiviral effect, and antioxidants. They have been, and some of them are very prominent. This is a combination that can be given as a preventive as well as therapeutic, and it can be given with an add-on therapy to the modern medicines that are prescribed in COVID-19, with the antiviral therapies if available. And then we have here for respiratory infections, these are the classical medicines that are recommended, and that all these have been time tested, and there have been studies done on these all these in various respiratory diseases, and these have been found to be to act as the good expectorants. They are bronchodilators, and these are actually bronchodilators, anti-allergics, as well as immunostimulants, and plus they rejuvenate the lung tissues. That has been studied experimentally, that the drugs like, for example, Aslasus and Odusa and Bnafsha and Unnab, and Kata, they have been proved, I mean, experimentally, not clinically, that they rejuvenate the lung tissues. And for goggles, we have an formulation here that is Cassia fistula, Maltas, Pooth, Morus nigra, and all these. These can be used as goggles, and these goggles can be actually, they can be given, they can be done daily before sleep. And this is the fumigation, that is Lobon, Sandrus, and so this slide that I am giving here, I mean, what you view here in this slide, this is actually that can be that can help in COVID patients, since we have not carried any clinical trial yet to make sure that these are really helpful. But I have seen in previous slides the people have used all these, the ingredients of these medicines have already been used in Iran for the treatment of COVID-19 patients. So I can say, since these are time tested and they are free of side effects, these are our pharmacopoeial formulations. These formulations can be used in COVID-19 pandemics in this thing. And sorry for taking much time, and thank you. If any question, you are free to ask. Thank you very much. Thank you.
Thank you for your nice presentation.
Thank you very much.
Thank you. You're welcome. Okay, Mr. Grivas.
Can I leave? Or
yes,
I have
yes.
to? Can I leave? Thank you.
Yes,
Thank
yes,
you
yes.
very much.
Thank you, thank you. Okay, next presentation is next presenter is Konstantinos Grivas from Greece.
Hello to everybody. Just a minute to share the screen, I think.
Yes, very good.
I think you have a picture now.